Nimasha Fernando has the floor to present a multi-country analysis of the impact of COVID-19 on impact of multi-month dispensing for children living with HIV on antiretroviral therapy. Doing this for USAID. Thank you. You have the floor now.
Hello, my name is Nimasha Fernando. Today I will be presenting our multi-country analysis of the impact of COVID-19 on uptake of multi-month dispensing for children living with HIV on ART. On behalf of our team listed here from the USAID Office of HIV/AIDS Prevention Care and Treatment Division. Thank you to the International Workshop on HIV Pediatrics and the conference coordinators for the opportunity to present. This presentation was made possible by the support of the American people through USAID under PEPFAR. The views in this presentation are those of the authors and do not necessarily represent the views of USAID, PEPFAR, or the US government. We have nothing to disclose. Children living with HIV or CLHIV who are stable in ART are eligible to receive multi-month dispensing, abbreviated as MMD. MMD is defined as receiving a 3-month or greater supply of ART. Advantages of MMD include promoting continuity of ART, as well as decongestion of health facilities due to less frequent ART pickups. These advantages are key priorities, especially during COVID, when efforts seek to reduce potential exposure to SARS-CoV-2 at health facilities. Although MMD has benefits, uptake is varied by country during COVID-19. This analysis reviews USAID PEPFAR MMD data to assess the uptake of MMD and proportion of CLHIV 0 to 14 years old on ART receiving MMD. Data is from fiscal year 2020 quarter 1 to quarter 3, so October 1st, 2019 to June 30th, 2020. ART categories were defined as less than 3-month supply, 3 to 5-month MMD, or 6 or more month MMD. Treatment volume was defined as the total number of 0 to 14-year-old CLHIV on ART. 12 countries listed here where PEPFAR USAID is supporting CLHIV and MMD were selected for this analysis. Moving to the results, in the following slides you will see the 12 countries represented along the x-axis and the percentage of children 0 to 14-year-old on treatment along the y-axis. Red columns represent fiscal year 2020 quarter 1 data, yellow columns represent quarter 2 data, and green columns represent quarter 3 data. Our results first showed that from FY20 Q1 to FY20 Q3, the mean percentage of CLHIV on treatment receiving less than a 3-month supply of ART decreased from 65.2% in FY20 Q1 to 39.2% in FY20 Q3. In every country, the percent of CLHIV receiving less than 3-month supply of ART decreased from FY20 Q1 to FY20 Q3. This decrease may reflect more CLHIV transitioning off of the less than 3-month supply and onto a longer MMD supply. When looking at the percentage of children receiving 3 to 5-month MMD, we see that the percent increased in all countries during COVID-19. In FY20 Q1, the mean percentage of CLHIV on treatment receiving 3 to 5-month MMD was 33.6%, but grew to 54% in FY20 Q3, an increase of 1.6 times as 84,725 CLHIV were receiving 3 to 5-month MMD by the end of FY20 Q3. However, the range of percentage of CLHIV receiving 3 to 5-month MMD in FY20 Q3 was between 28.2% in Uganda to up to 90.4% in Eswatini, reflecting differences in uptake by country. The number of CLHIV receiving greater than or equal to 6-month MMD more than doubled from FY20 Q1 to FY20 Q3, jumping from less than 4,000 CL-HIV in FY20 Q1 to 10,869 in FY20 Q3. However, the percentages of CL-HIV on treatment show that the percent of CL-HIV receiving greater than or equal to 6-month MMD remained low, and only reached 6.7% by the end of FY20 Q3. The range of percent of CL-HIV receiving greater than or equal to 6-month MMD did vary from 0% in Mozambique to 17.3% in Nigeria, again showing varying MMD by country and possibly also reflecting varying national policies on 6-month or greater dispensing. To summarize, our results show that for CL-HIV 0 to 14 years old in the 12 included PEPFAR USAID supported countries, dispensing of less than 3-month supplies of ART decreased during COVID, 3 to 5-month MMD increased moderately, and 6 or greater month MMD increased, but overall numbers remained low. In conclusion, MMD uptake increased during COVID for 0 to 14-year-olds from FY20 Q1 to FY20 Q3. Given the advantages MMD offers, such as helping families synchronize ART pickup, decongesting health facilities, and helping free up resources that can be dedicated to newly diagnosed and virally unsuppressed people living with HIV, MMD should be standard of care for stable CL-HIV. Even as COVID-19 restrictions lessen, we recommend that countries continue to prioritize MMD for CL-HIV and continue efforts to ensure stable CL-HIV less than 20 kilograms can access a 3-month supply of ART, and CL-HIV greater than or equal to 20 kilograms can access at least a 3-month supply of ART, with the goal of access to 6-month MMD. Thank you.